In Uganda, faith-based organizations play a major role in delivering health services. Together, the Uganda Protestant Medical Bureau, or UPMB, and Uganda Catholic Medical Bureau, or UCMB, oversee nearly 500 hospitals and clinics nationwide, often serving the poor and marginalized populations of Uganda.
As a religious leader, my role, the first one, is to ensure that the people of God, wherever I serve, they are well spiritually, physically, morally, economically, and mentally.
Faith-based health facilities actively promote maternal and child health, offering pre- and postnatal care, safe delivery, and immunization. However, family planning services have historically been limited. Family planning is a life-saving intervention, especially in countries where access to safe delivery is inadequate and where women and girls experience pregnancies too early or too soon after their last birth.
For example, you get the mothers or the women who are drained because of producing children every year. Their health reduces, their capacities reduces, they are worn out.
28% of married women in Uganda have an unmet need for family planning. When the nearby health facility does not offer this service, women are unable to protect themselves against unintended pregnancy. Many other barriers exist, such as fear of side effects, social or even religious opposition to using family planning, and misperceptions of pregnancy risk. In 2014, UPMB and UCMB began collaborating with the Institute for Reproductive Health at Georgetown University to strengthen family planning within their health system. UPMB had been offering some family planning, but with this, project services were extended to community level through village health teams, and a number of options were expanded by adding fertility awareness methods.
My role as a family planning provider is counseling or health educating women on the use of family planning methods and its importance, then also providing them the methods of their choice, including the natural method and the artificial methods, because we have them in place.
Twatwalibwa ffe nga ba volunteers ne batusomesa ebintu batusomesa counselinga abantu mu nkola ze tutakozesa abasawo ze bawa abantu eza family planning nga gamba IUD, empiso, implant, enkola ya monobid, enkola ya 2D method, enkola ya LAM.
Unadda ku mpiso teyina kyenkola. Kusobola okulabirira abaana mu bulungi kukyantandika empiso.
Kulonda akaweta okuba nti nakozesaako ku makerenda ne gampisa bubi nenkozesaako ku mpiso nayo nentampisa bulungi kwe kudda kaweta. Family planning yo nnungi okusinziira nze bbanga lyemaze nga ngikozesa era nga nkunga abantu bonna abakyala badde ku family planning kuba yo nnungi ewe emirembe.
The best part is interacting with the clients and getting to hear the side of their stories and their views about family planning.
For UCMB, family planning service delivery was strengthened with the integration of new fertility awareness methods. Consistent with Catholic teaching, these natural methods are effective and considered modern family planning methods. This includes standard days method with cycle beads, 2-day method, and lactation or amenorrhea method.
It's a challenge, like also a misconception that Catholics do not use, but on ground, family planning is for everyone.
As we began this project, we began with a few we could talk to, but as we created awareness, we found out that people increase and people are demanding for the services.
I feel happy when I'm doing. Before I started working in family planning clinic, I was not popular as I am now.
The very uniqueness of being a provider of natural family planning is the methodology of natural family planning. It is so unique that it helps you to understand how unique the human person is. You really realize that you are so complex, but then it even helps to love yourself the more.
I use CycleBit as my family planning method, and the reason why I decided to use it, I found it convenient to me. After being taught all the other methods, I thought and I felt this monobid would be convenient to me.
It has improved my communication between me and my husband. And right now, it has improved on my family.
UPMB and UCMB also involved nearby religious leaders. Over 100 leaders across denominations and religions were invited to learn about the benefits of healthy timing and spacing of pregnancies.
We used to know that Bible does not allow family planning methods and all that. But during that session of sensitization, we were able to understand some Bible interpretation.
We got deep in the villages, actually, where there are most of our rural women. And when they hear it from me as religious, they take it on very easily.
Between 2014 and 2018, UCMB and UPMB project sites dramatically increased their reach with family planning. They now seek to expand this approach across their network and make family planning services available to all women and men in Uganda.
I just want to thank UPMB for their support in transforming our community, because initially our community, there was problem of maternal death and infant mortality rates.
My prayer is if the project can continue, it will be better, it will transform people's life.
My attitude towards family planning has improved or changed greatly and for better. I try to use whatever opportunity to share and to talk, or even to encourage other people to speak about it, so that they can at least learn and be able to appreciate.